One day, Katie wasn't feeling well. Next thing she knew, she woke up in the ER. Katie has a heart condition and stopped taking her medication at home because it made her feel nauseous. Stopping the medication brought her back to the ER. Once she is stabilized, the nurse tries to investigate how this happened. She finds out that Katie stopped taking her medicine and is now refusing the medication that will keep her condition from getting worse. The patient is aware of the risks of not taking the medication and knows this will happen again if she doesn't comply. Patients have the right to refuse treatment, but our jobs as nurses, we feel obligated to take every step into saving a life. But we are also trained to respect their wishes. These two commonly conflict. The nurse decides to take things into her own hands and talk to the physician. The nurse knew this patient didn't want to die and needed her medication, but what could she do? After educating the patient on the severity of her situation, how can you do the right thing to get the patient to comply? The nurse decides to go and talk to the physician. It is important to speak up for the patient, especially when you know the doctor can prescribe an alternative drug. The nurse asked the physician if he would go talk to the patient. When she enters the patient's room, she asks Katie, "I understand you stopped taking your medication. Why is that?" She replied, "It made me feel nauseous and dizzy. I couldn't function. I felt better before I took the medicine, even though it's supposed to help with my condition." The physician responds, "Your symptoms will only get worse if you don't take this medication. I understand you experience some intolerable side effects, which is common, but you can't just stop taking medicine with this condition. It's critical for your well-being. Everyone reacts differently to certain medicines. There are other medications for your condition that you can take. If I switch your medication to another kind with less side effects, would you be willing to take that?" She replied, "Yes. Thank you so much for hearing me out. I wish I talked to you sooner." Medication is not only about the prescriber, it is also about the patient's willingness to take it.